so we've already done x-rays, intraoral photos, and perio probing. I'm gonna lean you back. We're gonna use our disease detecting liquid. Whoa. Radio. Okay. So my disease detecting liquid, I put a paint all over your teeth and it turns purple. And wherever it sticks, it's going to show me where biofilm is on your teeth. I'm going to do that first. Here's your chapstick, rub on your lips. Alright. Okay. Alright, I'm going to get you to swish with this water. Look for that. You can just spit it right back in the cup for me. Okay. And now I'm going to get, see where the purple is sticking, and just kind of get a plaque index score. I'm going to sit you up and we can go over what I've found. Alright, so from your plaque index score, I noticed that there is about 60% of plaque left in there. We like to see below 10%, so there needs to be some working on brushing and everything. Biofilm adheres to your teeth and it's essentially plaque, and it can turn into gingivitis and it can lead to decay and periodontitis. So with periodontitis there is bone loss, and gingivitis is reversible, but periodontitis is not. Alright, so since we got your score and everything, I'm going to go over the x-rays that we took earlier. Alright, so these images right here show a little bit of higher bone level than what is healthy. So that shows that there's some bone loss, which indicates some periodontitis, periodontal disease. And over here as well, I don't see any decay, so that's a good sign. And do you remember earlier in the appointment when we did the perio charting, I was calling out all those numbers?
Yes.
Okay. So 1 to 3 is normal, and with your chart, it kind of shows there's some 5s and 6s. With 4s, it's a red flag, but we like to get control of it then. But with the 5s and 6s, that indicates periodontal disease. Also, with these red dots right here, that shows bleeding on probing. So you had about 50 spots in your mouth that bled, and we like to see about 0 to 15 bleeding spots. So that is of concern as well. Let's go to your intraoral photos. Right here is some inflamed tissue, and you see how your gums are a little blunted right here and very red and swollen. We like to look for pink gum tissue, and right here in your gingiva, we like to see it as a knife edge shape or a V shape. That shows that it's healthy tissue. And we also went through when we did your intraoral and extraoral exam, you know, I was feeling for lumps and bumps and everything. That is normal. All right, and you said that you had diabetes earlier when we did your medical history. Yeah, so with periodontal disease that you currently have and diabetes, if you don't get control of your periodontal disease, it's hard to control your blood glucose levels. So we need to get control of that. We need more appointments and more at-home oral care. So we are going to go over better brushing habits later. So I'm going to show you the purple on your teeth. Alright, so you see all those spots. And earlier when I was going over biofilm, get my overgloves on, I'll kind of just show you my tree. So this is an aid that I made with biofilm, and there's a lot going on here, but with you and your diabetes, biofilm can lead to gingivitis and periodontal disease, which you are at. So with the oral systemic link, it's really hard to control periodontal disease if your diabetes is out of control as well. Here. So this helps us with brush. So I'm going to let you take this toothbrush, and I want you to show me how you brush. Okay, perfect. So just some modifications that I would do is when you're doing your lower teeth, go ahead and open for me back here on the back. I see a lot of inflammation, so I want you to kind of angle the brush up the handle towards your nose and just kind of do little circular motions up and down about 5 to 10 times per tooth. That will really help. And then the same on the upper, angle your brush handle down, and the same up and down circular motion. And in the front, kind of the same, running like this. And then in the back, I want you to go in and kind of angle the bristles up towards your gums and stimulate those gums since you have a lot of inflammation. Also, if you're able, an electric toothbrush is a great aid. It takes off biofilm more efficiently than a manual toothbrush. So you can do it and it will remove that biofilm that is there adhered to your teeth. Also, you said earlier that you don't floss, you just brush once a day. So if you were to floss, could you show me how you floss? Okay, perfect. So I'm just going to show you right here on the front. You would go down and create a C shape for each tooth, and then in the back the same. Go down C shape and then go up and down 5 times on each side. So you go down here, go right here, up and down 5, same on the top. Go up right here, C shape, up and down 5 times. Go the other side, up and down 5 times. Same with over here, up and down, up and down. And that will help remove that biofilm that is down in your gums, which can also lead to your bloodstream and other health issues. Do you think you can do that for me? Yes. And we can get control of this? So these are also called interdental aids. They are disposable and you can buy them at Walmart or any drugstore, whatever you'd like. And on the go, you can put these and stimulate your gums, which will help with the periodontal disease. Periodontal disease is not reversible, just like gingivitis. So we just need to get those numbers at a plateau where they're not progressing and having any more bone loss. Alright, so I want you to take the toothbrush and show me what I showed you. Perfect. Very good. And then you can take this as well and show me the C shape. Very good. It's all good. It's all good. And are there any questions or anything in tying it all together? Brushing twice a day, flossing once a day, and no eating candy. Well, you can eat candy, but in moderation. Just make sure to brush after eating candy because that acid on your teeth just it stays on there for 20 minutes after. But no questions?
No.
Okay.
No questions.